and she's had the privilege to educate thousands on a variety of topics relating to the end of life care. Please welcome Ellen Hoekstra.
Good afternoon, and thank you for having me. Can you hear me?
Yes.
Yes. Can you see my PowerPoint?
Yes.
Okay. Well, I can't tell you how much I appreciate this day of education and appreciate being chosen to be one of your panelists. I think that it has been a tremendous day. When I saw I was the last presenter, I thought, oh no, everybody's going to be so exhausted. But given that this is freestyle, I am always a fast speaker, and I know I'm going to get you over the finish line in time. So this is a little lighter than some of the other topics, and I just want you to sit back and relax and listen. So I'm going to minimize myself over here so I can make sure I can see all my slides. Our objectives, we're going to talk about the goals of Namaste Care, look at some of the tools we use to provide this patient-centered personal care, and then look at 3 benefits of Namaste Care and demonstrate the steps necessary to create an environment of care. So this is my first amazing picture for you, and if you can see this, this will make you happy. But I like to start with a case study to really illustrate Namaste Care to you. So Ethel is a 80-year-old patient or resident of a long-term care facility with Alzheimer's dementia. And Ethel probably is very, very familiar to you as she is a pacer. She is constantly pacing. She's looking for something, but she cannot communicate what she needs. Ethel rarely smiles, and she's got that distressed, pinched kind of look on her face. Ethel's also very high risk for falls, and she's losing weight. So in this particular community, there was a Namaste Care room, and a Namaste Care room is just a quiet room kind of set off to the side. The lighting is dimmed, just maybe table lamps. Nice music is playing. There's a scent of lavender kind of in the air. There's recliners for the residents to come in. And when they do come in, they're greeted by a warm washcloth so we can wash their hands and face. So Ethel was escorted to this Namaste Care room, and she was put in one of the lounge chairs, which made it a little more challenging for her to get up. And then we tucked a quilt around her. And then she was introduced to, and this picture of this stuffed animal is small, but we introduced her to a rather giant stuffed animal. And right before our eyes, we could see her face transform. And it went from that pinched, stressed look to a smile that was almost as big as this dog. The next step was to put the dog in her lap. And we had tried this before, but we tried it with a little tiny stuffed animal that she ended up throwing on the ground. This time, we put the stuffed animal on her lap and asked her to take care of it. And so another miracle started to happen where she started to cuddle this dog and talk to it. And the next thing we knew, she fell asleep for about 30 minutes. So it gave this resident a total of 60 hours or 60 minutes. I wish it was 60 hours, 60 minutes of peace, as well as the staff from her, wandering around the community. And this is the Namaste approach to care. So at Seasons, we strive to find creative solutions to add to quality of life for our patients. And that's part of our vision statement. And we had the opportunity to work with Joyce Simard, who's internationally known for her work with Alzheimer's and dementia patients. And she's created a couple different programs called Memory Care Enhancement, the Club, and she worked with us to create Namaste Care. As you know, this is a devastating, absolutely devastating diagnosis for our patient and their family. And so we wanted to offer something special for that particular population, and this program was created. I want to read you this because I think it's beautiful and it's at that time of the day where we need this. Namaste. I honor the place in you in which the entire universe dwells. I honor the place in you which is love, of truth, of light, and of peace. When you are in that place in you and I am in that place in me, we are one. And I think that's absolutely beautiful. So namaste, you may see a variety of different definitions. It is a Hindu greeting, most often heard here in the United States at the end of a yoga class as really a farewell to the students. We see the two hands clasped, kind of like in a upward prayer position, kind of pressed together, held near the heart, and the head is bowed as the person says, namaste, go in peace. So the word namaste really expresses a wish to honor the spirit within. And that's why Joyce selected this name for the program to describe a special way of caring for residents in their nursing homes, assisted living communities. We do it in our inpatient units at hospice, or even in our patient's home, and for Alzheimer's and dementia patients. The philosophy of Namaste Care really supports the belief that the spirit of the resident with advanced dementia continues to live. And we see that spirit. We see that in their eyes, in their smiles, and their response to loving touch. And that spirit is undaunted by the disease. It's the spirit way beyond the disease, and it's really the essence of that person. So this is kind of a little philosophy statement that we have for Namaste Care. And it says, we believe that the spirit in each person lives regardless of their physical and cognitive status, and that is impossible to nurture the spirit it is possible to nurture this spirit in each individual through loving touch and meaningful activities. This spirit thrives when our patients, our residents, are in the presence of others. So we also have a mission statement for Namaste Care, and I will tell you, this Namaste Care program is provided by our entire interdisciplinary team, sorry, IDT we call it for short, now you know why. But it really even starts before someone comes on to our hospice program. As part of our information session, our hospice care consultants have to come back with not only, kind of the medical information, and we look for 3 non-medical things. What should I know about this person before they come on to hospice so that I can start their plan of care right there? So I don't look at them as, someone with stage 4 cancer. I look at Mary Smith. I don't look at them as end-stage Alzheimer's patient coming on. I look at Mr. Jones. And so that's really important. So our team sees those non-medical information about the patient so we can start to build that plan of care. It really is a holistic approach to care that ensures the burdens and the benefits of each medical intervention or nursing treatment are weighed so that they support each patient's quality of life. As you know, our goal in end of life is to provide comfort and pleasure, and that is really the goal of Namaste Care, as well as increasing their quality of life. So every day we try to make sure that quality of life experiences are offered. And again, the entire team is involved in doing this. So not just, CNAs or nurses, but our music therapists, our chaplains, our volunteers, everyone participates in this particular program. And I started, just so you know, my nursing career when I was 15, and I started in a nursing home, and that was 42 years ago. And I wish I could go back and have all this knowledge that we have now to take care of someone with end-stage dementia or Alzheimer's disease. So, you know, I'm building on all of our speakers, I think, from this afternoon, from Rebecca to Mark to Julie. And Mark had brought up person-centered care. And we in the industry have heard that word now for years and years and years. But what does it really mean? And Mark said it's simple, and it really is. The first is to treat that person with dignity and respect. And that is so easy to do. But we need to understand who they are and what their history was about, what their lifestyle, culture, and preferences, their likes, their dislikes, their hobbies, and their interests. We need to know all those things. And then I think Mark kind of touched on this a little bit before, kind of looking at the situations from that person with dementia's point of view, not our point of view. I always ask everybody, as adults, do we like to be told no? And I think overwhelmingly, not many of us want to be told no. And I think we need to remember that. And so we've learned a lot of different techniques to work with this particular population. So instead of me yelling no, no, no when somebody wants to go into the kitchen at the nursing home, I know that I can just go over and kind of redirect that, gently take that person's hand and tell them I need their help with something, instead of yelling no so many times. But we really want to provide opportunities for the person to have conversations and relationships with other people, and ensuring that they have the ability to engage in different types of activities. So the respect for individuality, when we do this program for our patients, and again, this was originally for Alzheimer's and dementia patients, but so many of the techniques that we use are so appropriate for our patients at end of life. Any of our patients will qualify for this program. And so we start with a lifestyle appraisal, again, looking at that history, looking at, you know, where did they work? Did they work at all? What were those hobbies? What were their leisure activities? Their daily routine is really important to me, because if you're 90 years old and your routine was to take a bath every morning at, say, 9 o'clock in the morning, well, if I were to come in your room at 5 o'clock in the morning to do your daily care, you might be a little combative. So I want to know if you took a bath, if you took a shower, those type of things, and then really look at what your sensory preferences are as far as foods and textures and your lotions and potions and all those kind of things, and any kind of smells that may be associated with your occupation or so on. And then we look to see, you know, how did this person want to live their last days? And really, this is care planning and the basis for all of our care planning with the Namaste program. So criteria for admission, this is certainly a free program that we do, again, for our patients, originally, again, for dementias, end-stage Alzheimer's, but you can see there's a wide variety of different diagnoses that would benefit from Namaste care, or late-stage Parkinson's patients, or COPD, even CHF patients, any agitated or depressed residents, you know, and the list goes on and on. So we each have, and it's labeled as such, a Namaste care bag. So you may see, if you're in a nursing home or even assisted living community, you may see our CNAs come in because they really take the lead in this program with a Namaste care bag. So in that bag we have, I call it my bag of tricks. We certainly have basics like gloves, but one of the things I put on here is Pond's cold cream. And for the generation above me, I wouldn't say me, that was probably the only choice for ladies. And so it's a very familiar smell. We also have Old Spice in that bag, which may be very familiar for men. Certainly infection control is, you know, we've always been vigilant, and now more than ever. Everyone needs to be. So we have some Q-tips and little spoons and med cups in order to put these in those little cups and not share anything in between residents. We have those safety razors, combs, and brushes. Non-institutional tissue. Think about when you've had a cold and you have some rough sandpaper tissue. So it's just nicer to have some soft tissues. Certainly our hand sanitizer. We're going to talk about lavender and the role that that plays in relaxation. A special hand lotion. So again, not, you know, hospital-based brand or whatever, something maybe from Bath and Body that smells a little bit different. We enjoy doing, and our CNAs have the time to do you know, fingernail painting. I want to say manicure. I was having word finding issues, everyone. Do manicure for that resident. Seasonal items or aromas, something we can share with that resident or patient. They may carry a binder with certain poems. Think about if you were religious and I came in and you had end-stage Alzheimer's and you're combative with bathing. Maybe if I came in and I learned this from your family, that you would enjoy me praying with you. So I may start your personal care with praying the Lord's Prayer with you. And think about how long that would take. I think I timed it and it's not even more than 30 seconds, but just to start that personal care a little bit differently than traditional. I am a nurse by trade, and I was trained to do that, you know, head to toe bed bath. Well, you guys know bathing someone with end-stage Alzheimer's or these dementias can be very, very challenging. So I'm thinking about different ways with this program to make you more comfortable and start that personal care. So I may come in and I may have, you know, your bath basin and I fill it up with warm sudsy water of your favorite scent, and I may soak your little arthritic hands in that and then give you a nice little manicure. That's certainly very different than me coming in and taking maybe the coldest, wettest, dripping washcloth and putting it on your face. I think I'm going to get a very different reaction with you pushing me away as opposed to me giving you a nice you know, manicure and hand massage. Fun objects. I'm not a huge fan of bubbles on a memory care unit, but we have used those. I have a picture of that at the end. But textured cloths or stress balls. One of the places I went to help create Namaste care bags was the dollar store. None of this has to cost very much money, and they have some very interesting, very colorful chamois for $1 that I have put in my bag. Again, if I choose to use those with a resident, I would leave those for that resident, but we're talking very, very low cost with that. Certainly our CNAs, if you happen to see them playing music, the only music they are allowed to play is on an approved music list, and we have assessed with the family what that particular resident or our patient's music choices are. Lollipops, and I have a case example where that comes in very handy. And again, those pleasant pictures. I have mine in, I've taken them out of magazines of, you know, scenes or animals or flowers, and I have those in one of those sleeves, and so I can leave that with the residents, something beautiful for them to look at. So Namaste care, again, costs nothing. We can provide that care at the home, nursing home, in the hospital. I'm sorry, guys, I forgot to include a beautiful picture of an assisted living community, but we can do this program anywhere we go. So I want to share another case study with you, and this is Daniel. And Daniel came to our inpatient unit. He was stage 4 metastatic cancer patient, and he was admitted to our inpatient unit for uncontrolled pain. And he was in so much pain, and he was agitated. His body was kind of moving all over the place, and he just really didn't even have the energy to speak to us. So he would just nod his head. So the CNA had gone in, and he, you know, we're trying to manage the medications, and the CNA went in in and asked permission to shut off his TV, and he nodded his head yes. And then what she did was create a Namaste care environment. And again, we can do this anywhere by lowering the lights, closing the curtains, you know, playing soft music, kind of spraying lavender on the bed. And Danielle just kind of, with big eyes, just kind of watched what she was doing. And then she began to talk to him with very soft, loving words, telling him he was loved and he was special. Then she began stroking his head and face and kind of giving him a little massage. And eventually he stopped twitching and he fell asleep for an hour. So again, she wasn't doing personal care. She was just trying to see what else she could do to promote comfort in our patient. So creating the environment, it's really, really important to have a Namaste environment. If it's all chaotic around me, and I try to do this in the dining room or at the desk, it's probably not going to work as well as if we can, you know, do it in the resident's room. So we always, always, always knock on the resident's or patient's door before we go in. We also have a sign that says Namaste Care in Progress, and that we put on the door so that the staff knows, you know what, for this next half hour or 45 minutes, we're kind of in a cocoon with no interruptions, so that we can provide this type of care for our patients. Now, often our patients are in semi-private rooms. So we're always going to talk to the person in, you know, the other bed to make sure that they understand what we're kind of doing with our patient, and maybe ask to lower the lights or to turn off the TV, just knowing that it's going to be a short time. If they have visitors, this is a great opportunity to have those visitors go take a break, and so that they can take care of themselves. So maybe they've been at that bedside for hours and hours, and so we assure them, you know, we're going to take care of your loved one, and you can take a break. Again, drapes open, closed, it's really based on that particular patient's preference. We're going to spray lavender, maybe start some soft music, and then begin that sensory-based approach care to their bed bath. Or as you could see with that previous example, we were just trying to do what we could to, while the medicine was taking, the pain medicine was trying to take effect, to keep that patient a little more comfortable. So this is my absolute favorite case study, and I like to call him Farmer Joe. And he, I think you all know that, again, it's very challenging to bathe some of our residents. So this particular resident was 83. He was in the nursing home. He had end-stage dementia. He had COPD. He was quite obese at 400 pounds. And Farmer Joe was always combative with his ADLs. He always refused to get cleaned up. He just would not cooperate. The staff was almost afraid of him because of his size. And apparently he used quite, and I put it in quotes, colorful language with the others, with staff members. But the family was always concerned that he wasn't getting bathed. And so they weren't exactly happy. And, so that we've got the family on one side is saying, bathe dad. Dad is not cooperating, and we're doing what we can to facilitate that. So he really seemed to be a good fit for Namaste care, certainly based on his diagnosis and all those challenges facing the team. So when we happened to complete that lifestyle appraisal, that's when we found out Joe was a farmer, and we had not known he was a farmer. And so that was really important. So when Joe was farming, he would wait to the end of the day, certainly when he was done with all his work, to get cleaned up. So we had this brilliant idea of what we would do with Farmer Joe. And we went ahead and I think everybody knows those pink hospital bath basins. Well, what we did was we went out and we got 2 of those bath basins. We filled them with dirt. We provided them to Joe and we gave him seeds. So he was able to plant his seeds. And then naturally, when he was done, he wanted to get cleaned up. So it's using what we knew, and we were kind of taking a chance to see, you know, what we knew from his history. We were kind of taking a chance to see what he'd do with this dirt, but he was very thrilled, and it was very, very natural for him to get cleaned up. And that's what it's about, taking what we know and just trying something. You know, it hadn't been working. What else can we try? And that's my responsibility, to try to figure out how can we do this, and what can we do for this particular patient or resident. Now, we all know Alzheimer's, dementia, stair step down, plateau, decline. Our plan of care has to be constantly updated, but this worked for a couple of weeks with Farmer Joe. So it was so beneficial, and to say the least, the family was pleased. So Namaste Care, as you can tell, is really about stimulating those senses to promote comfort and relaxation, reminiscence. And so we're going to look at stimulating the senses. And I have the most stimulating visual picture here that I could find. And I hope for those of you who can see it, you are visually stimulated. If you can't, it's a beautiful sunset over some mountains and pretty flowers. So I think you'll all agree vision is our most important sense, and it's we gain most of our information, as well as it really offers the broadest range of possibilities for stimulation. So we have a variety of little tricks in our bags, kaleidoscopes. I used to have a baton with the water inside with the little flecks. Somebody ended up stealing that out of my Namaste bag. But I was able to see if the resident could track with that particular wand. But again, the colorful paintings, nature movies, those pictures that we carry along of dogs or cats. So I've learned from your family, you're either a cat person or a dog person, or maybe you like lions. So I might have prepared that in advance. Flowers, beaches. If there's no family to draw from, I might try a color, maybe, you know, all purple or all pink or all green or blue, or something for you to kind of look at. We also have those little non-flame kind of candles that kind of flicker and can relax some of our patients. Auditory stimulation, I think our ears are probably the second most vibrant source of sensory stimulation that we have. And so any sounds, nature sounds, rain sounds, waterfall, the wind blowing through pine trees, which sounds pretty good right now, they may work. Bird sounds. You know, I'm a person who, I don't like chaos, so I wouldn't like any loud kind of music, or probably sitting at the nursing desk where it's more chaotic and kind of noisy. So I might like something, you know, in my own room with some gentle kind of sounds. So remember, our CNAs are not playing their music choices. It is only approved when we have assessed through the family what that particular patient wants. I think, you know, since I come from hospice, I just want to remind everybody that we know, and studies kind of show, that hearing is our last sense to go. So again, it's really important to not talk over that person, and to play music, and to continue to talk to them softly near end of life. Now, we did touch on music therapy today with Rebecca, and I will tell you, we at Seasons are the largest employer of music therapists in the hospice, largest employer of music therapists in the country. And we really use it as an adjunct to medication therapy. It is a medical intervention to increase quality of life, and it touches on all 4 domains of quality of life, from physical, social, emotional, and spiritual. And I know Rebecca went over many of the different techniques that we use two that I'd like to share with you that we really focus on in end of life, you may not be familiar with. One's called the ISO principle. And again, I'm a nurse. This is coming from a nurse perspective, from my music therapist. But this really has to do with the patient's mood. So we need to keep that in mind. So if I go in and I find my patient crying in the room, and I'm there for music therapy, or just trying to play some music for that resident, I'm going to start very, very softly and slowly, maybe playing some melancholy type chords. As I start to change then the music a little bit and start to increase its tempo perhaps, then I can maybe perhaps lighten that mood of the patient. The other technique they use is called entrainment. And we often see the music therapist work with our patients who are short of breath with this particular technique, where they're breathing 40 times a minute. So they are going to start that music at like 40 beats a minute, really, really fast, and then slowly bring that down, and we can normalize our patients' breathing without medication. So it's just phenomenal to watch these board certified specialists in action. And certainly there was a discussion earlier, coverage for music therapy, certainly available to all of our patients on hospice. So taste, and I really hope you can see this particular picture because it looks delicious. And again, if you're listening on your phone, it's somebody biting into a big red juicy strawberry that looks amazing. And I think in many ways, taste is one of our more pleasurable senses, depending on how you or how much emphasis you put on food and on eating. Pleasure feeding. So we see patients at end of life, and certainly there is such a myth at end of life that we don't feed anyone, that we starve people in end of life. And you know what, even our end stage Alzheimer's and dementia patients, you know, we will try to do pleasure feedings for those particular patients. I've given you some ideas, and again, that's why we have lollipops in our Namaste bags, but some of the, you know, softer foods that we can introduce with our patients who may be, you know, not eating anymore, or even have a feeding tube. Even flavored lip balms, as long as they're not Vaseline based products, if the patient's on oxygen, gives them that sense of pleasure, their favorite taste. So if you like cherry, maybe we can try that cherry lip balm on you or something like that, to make it very appealing for you. Oral care is really, really important, particularly in end of life. So we have those little toothlets in pink and in this aqua color. But you know what, even for my patients who are at high risk of aspiration, that I can't do pleasure feeds, maybe they have their feeding tube, and I can still kind of saturate these toothlets with just about everything. And you see my choice at end of life. If I am in your community, please saturate with a little Diet Coke so I can have that flavor. A lot of people in hospice don't want the diet part, they want the whole Coke, but with the sugar added. But for me, so we can do those kind of things. And I think it's really important. Part of Namaste Care teaches us that your families need a replacement behavior when they come in to visit. So if I was coming in breakfast, lunch, and dinner to feed my loved one, and now they're at a stage where they have the feeding tube, they're at high risk for aspiration, what can I do? I'm going to kind of feel useless when I come in to make that visit. So to have them have a meaningful visit, what else can they do? You know, can they saturate something with a little tiny bit of flavor? Can they do the oral care and put the lip balm on and do those kind of things? Or can they do a hand massage with a special bottle of lotion, or maybe a special reading? So we really need to think about those families, and I can't imagine what it must feel like to not be able to feed my loved one any longer. All right, so now we come to smell.
Ellen, can
And
I ask you a question? Somebody asked, could you repeat the name of what you do to slow down the breathing with music therapy?
oh, sure, that one is called entrainment. And I can flip back to the slide.
Thank you.
It's entrainment, and they kind of match, you know, the rhythm of that particular patient's breathing to the rhythm of the music. And, you know, part of we have a compassionate ventilator removal program. And believe it or not, our music therapists are key when we remove someone from the ventilator. So they are always in attendance. And it's kind of interesting because the family will say, not the guy with the guitar. Well, then we kind of explain, you know, no one wants to see their loved one struggle to breathe after they come off the ventilator. And certainly we pre-medicate and whatever, but if they're breathing 40 times a minute, again, those trained therapists can match how they're breathing, and they can do it to you or I right now. They can bring our breathing down so low with the rhythm of that music. And it is truly amazing to watch them do that. So entrainment. Okay.
Thank you. Thank you.
Sure. Uh-huh. All right, so smell. I think this picture says it all. This puts me at peace. Just seeing aromatherapy and this lavender out in the field. So some of the scents that we use, and there's been a lot of research. Now, again, I read pretty much everything, but you know, particularly with lemon balm, I haven't found a good scholarly article. So, but we do know traditionally lavender is said to be calming and to balance kind of emotions, used as a kind of an antidepressant in insomnia cases. You see the scented lavender lotions in the commercials for the babies and children for lavender. And so our staff does carry lavender body wash with them. And we make lavender spray. We're kind of cheap. So what we do is to get the essence of lavender, we have little tiny spray bottles that we can use for each individual patient, and just put a couple drops in and spray their bed sheets and spray the room with that to relax them. Now, as I said, I'm not a lavender fan. So if I have my end stage Alzheimer's and you come in and you start doing that, I might get agitated. But then you've learned from my family that maybe I do like the scent of lemon or rose or something else. So that's why it's so important when we can to do those lifestyle appraisals with our family. Lemon balm is another really interesting one, and I'd say this one has the most research on it for Alzheimer's dementia. It can be very costly. There is lemon balm teas, so they would have to be in a stage where their Alzheimer's dementia is not so advanced. They also suggest rubbing the oils on their hands or on their face. So I'm not sold on that. Peppermint, though, I have just bought a big giant bottle of Dr. Bonner's soap, if you know that. This is used to stimulate the mind and also calm the nerves. It also is said to rectify absent-mindedness. So you can see why I just ran out and bought a big giant bottle. It's worth a chance. Plus it makes your skin feel kind of tingly and nice, but that smell of peppermint goes away. So just anything we learn from that family. So really important to have those certain scents. All right, touch, and I have to read you this. It says, the first thing is having the experience of touch, of profound contact with things, with the universe, without mental commotion. Everything begins there, touching the universe deeply. When you touch deeply, you no longer need to let go. And I love this. One of the most striking case studies I remember from seeing Joyce Simard for the first time was that she always asked permission to touch someone, which I think, you know, as a nurse, I can tell you I didn't. And it was really interesting because she had an essentially nonverbal end-stage Alzheimer's patient, and she went up and asked if she could touch this resident, and they kind of nodded. And she just just gently put her hand on her face. And the resident leaned into her hand, and I'm telling you the truth, folks. The resident said, "Nobody's touched me like that for years." And I thought, wow, you know what? Sometimes as a nurse, I've been very task oriented. So I go in, I need to take your blood pressure. I don't ask you, much. I take the blood pressure and so on. But really, just that touch, instead of a task, just that gentle touch made so much difference in that resident's life. And she spoke for the first time in a long time. So anything we touch can be very, very stimulating. There's some great pictures here, and we have these in our memory care bags. Anything with a lot of texture. One of the things that we do, and I'm sure a lot of you are familiar with these busy aprons. Well, again, we're on a budget, so we have a sewing circle that creates our own busy aprons. So we took the aprons from Home Depot, flipped them around so you can't see their logo. They're quite cheap. And we have a sewing circle that attaches certain things. So if I have a history of loving to bake, they will, attach measuring spoons, a couple measuring cups, and so on and so forth, so that we can tie these around their waist, and they always have something to kind of fiddle with during the day. So we customize them for our patients. We also created seasonal bags, so a winter bag, a spring bag, a fall bag, those kind of things, so we can bring those out. And again, anything used on any resident or our patients is theirs from that point forward. We don't kind of take it back. One of the other things we have, since I've got like 8 minutes here, is one of the Paro seals, and it's P-A-R-O seal, and it is one of those white seals that have the big blinky eyes. And we bought that years ago, and they were quite expensive, and it's a very expensive robot, but we use that for our Alzheimer's and dementia population. It's weighted like a baby, like 8 to 10 pounds. And when you pick this paraseal up, you hold it kind of sometimes like a baby or pat it like a baby. But it is a very, very intelligent robot that responds to loving touch. So the resident, we can put it in their bed, they can stroke it. It responds to voice. And so the longer you're with it, it learns your behaviors and responds to you. But if I were to hit it, it would not respond. But they blink their eyes, they turn their face. She lives in what we call a Moses basket, and her plug is a pacifier. It's an amazing, amazing thing. And I've worked with so many Alzheimer's and dementia patients, and I think the women tend to appreciate it more than the men do, but it's extraordinary. And especially for somebody who's homebound or bedbound who thinks it's maybe their pet, it's just an amazing thing. So I have one last case study in here for you, and this kind of illustrates the tranquility and peace we can bring to a family with this program. So this is about James and his wife, and James was 81. He had advanced dementia. He was total care. He was bedridden. The wife was 80 years old, and she was the primary caregiver, and she had a history of a heart attack 1 year before we were seeing her. She had just lost her sister, and she often babysat for her 4-year-old great-granddaughter. And when our CNA went through that door, she realized that this wife was in more need of Namaste care than her husband, who was sleeping very peacefully. So what the CNA decided to do was to lure the granddaughter out of the room with a sucker and turn on a children's program with the approval of grandma. And she set out to create a Namaste care environment for the wife. So she seated her in a comfortable recliner. She took her shoes off. She put a a quilt around her. She lowered the lights, sprayed the room with lavender, played some soft music, and then gave the wife a hand and arm massage. And the wife's response was, "Oh my," and she relaxed. So the CNA told her, just go ahead and, you know, rest your eyes for a minute or two while I go take care of your husband. And she provided Namaste care to the husband, who didn't really, frankly, seem to notice, but she kept watching the wife, and she said she was just sitting there over in the reclining chair, just glowing. And so that's the way, again, that Namaste care can really help. And I know that's probably not something you do in your environment, but being hospice, we kind of do those kind of things. But, you know, helping that wife just as much as we were helping the husband. So this, if you can see this picture behind here, and like I said, I'm not a fan of bubbles, but you can see this woman's face. And when we had gone in to do personal care, she was miserable. She was yelling out, and all it took was blowing some bubbles to get the smile that we got that day. But it's really about being present, loving touch, meeting their sensory needs, communicating with them, and then teaching our families how they can help and learn some of these techniques. And we really do see that it increases our patient as well as family quality of life. So I am going to see if there's any more questions. We are at 4, well, according to my